Robert F. Kennedy Jr. continues to do everything he can to harm our country's health by undermining confidence in vaccines, increasing vaccine hesitancy, and lowering vaccine rates. Welcome to STEM Now. I'm Laura DiDio, reporting the commentary prepared by Crystal, STEM Now's anthropologist and political activist. I hadn't intended to create another video about Kennedy so soon, but he continues to be the worst. As the Secretary of Health and Human Services, Kennedy is responsible for numerous agencies that direct our public health. Those include the National Institutes of Health, the Center for Disease Control and Prevention, and the Food and Drug Administration. It's important to note that Congress allocated funds for these agencies in Health and Human Services to implement specific initiatives. One of these agencies is the Office of Infectious Disease and HIV/AIDS Policy. This office has undertaken a campaign to increase childhood vaccination rates.
Vaccines contain a dead, weakened, or harmless piece of a virus or bacteria. Vaccines are like heroes. They teach your child's immune system to recognize the virus or bacteria and be ready to jump into action when your child may need it. Vaccines do a great job of protecting your child from serious disease and even death, so they can spend more time being happy and healthy. Learn more about how vaccines work at letsgetreal.hhs.gov.
The office also implements the National Vaccine Program. This was established to prevent the spread of infectious diseases through vaccinations. This office also implements a program titled Ending the HIV Epidemic in the U.S. So, of course, Kennedy is firing all 60 staff members of the Office of Infectious Disease and HIV Policy. This is just one part of his deliberate efforts to lower vaccination rates. Kennedy also hired David Geyer, one of the leaders of the anti-vaccine movement, to work as a senior data analyst. Geyer is examining the scientifically debunked claim that there's a link between vaccines and autism. No doubt the result of this study is preordained, and it will claim that there's a link, even though decades of scientific research has found no such link between vaccines and autism. Geyer lacks the qualifications for this position. He only has a bachelor's degree in biology. He's falsely claimed that there's a link between mercury in vaccines and autism. The studies he conducted in the past and published in journals have been found to be flawed, and the data has been manipulated. That's according to scientists whose work has undergone peer review and ethical review. Geyer has also been found to be an unreliable witness in federal courts. Back in the 2000s, Geyer and his father, who was a doctor, established autism clinics that performed various treatments on autistic children that they claimed would cure them. These treatments were falsely based on the premise that mercury poisons from vaccines caused autism, even though this had no scientific basis. They were also unethical and dangerous. At least one of these treatments used the drug Lupron, which shuts down the production of sex hormones, including testosterone. Lupron is the same drug that is used to chemically castrate sex offenders. In 2012, Maryland sanctioned Geyer for practicing medicine without a license and fined him $10,000. His father's medical license was suspended for endangering children with autism and exploiting their parents. Because eliminating the Office of Infectious Disease and HIV/AIDS Policy and hiring Geyer wasn't enough, Kennedy has forced Dr. Peter Marks, the director of the Center for Biologics Evaluation and Research at the Food and Drug Administration, to resign. Dr. Marks was the top FDA vaccine official during the first Trump administration. He successfully led Operation Warp Speed. That was the initiative that developed, manufactured, and distributed the COVID-19 vaccines that saved millions of lives in the U.S. and globally. In his resignation letter, Dr. Marks reminded us that George Washington made the controversial decision to order his troops to be given the smallpox vaccine, and that Dr. Salk and Sabine's invention of the polio vaccine eliminated the disease from the United States. That saved millions of lives here and around the globe. Marx also harshly critiqued Kennedy, stating, "As you are aware, I was willing to work to address the Secretary's concerns regarding vaccine safety and transparency by hearing from the public and implementing a variety of different public meetings and engagements with the National Academy of Sciences, Engineering, and Medicine. However, it has become clear that truth and transparency are not desired by the Secretary, but rather he wishes subservient confirmation of his misinformation and lies. As political activists, we must take action against Kennedy's misinformation and lies by raising awareness of the importance of vaccines in our communities, especially in communities of color and working class communities where access to health care is limited. This is more crucial than ever since the Trump administration's recent cuts to state public health departments. Being a political activist isn't easy, but let's go out there and be advocates on behalf of our communities and speak out against those who seek to do them harm. Thank you for watching. Please subscribe to this channel, like and comment on this video. Thank you.